Hello, Alex from Charlestown, Massachusetts, correct?
Yes, that's
Old
right.
Chucktown. And Dr. Patrick Nguyen is with us as well. So, Alex, you were experiencing severe headaches. You were vomiting. It's something that happens. This was 2 summers ago. And then did it continue?
3 summers
Three
ago,
summers
actually.
ago. And did it continue?
Well, I was like that for a couple of months, and then...
Oh, 2 months that was going on. Wow.
Yeah, and then I went to see my primary care doctor finally after it got really unbearable, and he told me to go get a CT scan of the head right away.
Yep.
And so I scheduled it for the next day, but later that evening, I guess I passed out, maybe had a seizure or something, and I woke up in the hospital the next day. They showed me the scans. It was a big tumor. They said it was almost the size of an apple.
Jeez.
Wow.
Yeah, and so I had surgery right away, and then I went through the standard regimen of treatment, chemo, radiotherapy. And unfortunately, I then had a recurrence only about 4 months later. So they had to stop my treatment at that point to have another surgery. And that's when I came to Dr. Nguyen at Dana-Farber. And he told me that they happened to have several research studies for my type of cancer. And we were, my family and I, we were just so glad to have that opportunity. And I had my second surgery at Brigham and Women's. My surgeon was incredible. I got really lucky, Dr. Pierre Peruzzi. And I'm really thankful to the whole team at Dana-Farber, to Dr. Nguyen, Dr. Peruzzi, the nurse practitioners, Deborah LaFranchi, Lisa Doherty, and finally my infusion nurse, who is the best nurse ever.
A lot of special people making it happen for you.
So Alex, you went to Dana-Farber. Was that because when the tumor came back, they told you that they couldn't do anything else for you?
Yeah, I was originally at Beth Israel.
Yep.
And yeah, pretty much that seemed like the end of the road for me there when the tumor came
So it wasn't,
back.
we can't do anything more for you, you need to go to Dana-Farber. They felt there was no more treatment for you.
Well, there was one last treatment, which was Avastin. So they wanted me to have the surgery there and then start Avastin treatment. And from what I've read, that didn't, that seemed to be kind of like a last resort.
So like so many people we hear of that often are people have told them, there's nothing more we can do. You go to Dana-Farber, you meet Dr. Nguyen, and it's just the hope all of a sudden comes back.
Yes, exactly.
So, Dr. Nguyen, what was your first experience meeting Alex? How did that go?
It was a very scary situation for him because the tumor had come back very quickly, and so we were trying to help him decide what the best treatment options were. And it happens that we had a few clinical trials. One of them was the one that Alex went on eventually. As you know, Dana-Farber has been at the forefront of using immunotherapies, using the immune system to fight cancer. But brain tumors are particularly difficult. The drugs that are approved for many cancers have not been working that well for brain cancer. The tumors make molecules that suppress the immune system. So Alex went on a trial where we gave these drugs before surgery to try to understand what the drugs are doing so we can improve on it. But the surgery also gets rid of all these immune cells that are suppressing the immune system. And that combination, I think, is what's helped Alex. So you had your surgery in February of 2017, and things, the scans still look great, and Alex has done really well.
One of the things I think about is, obviously the patients and the families and the kids and everybody related to the patients. They have a bad day. Let's say they have a big support system. Let's say you wake up in the morning, doctor, and you have a bad day, and say you have surgery. Like, how difficult is that for you to compartmentalize what's going on in your life, knowing that you have such an important job to do, and how difficult that is for you to get through the day when maybe you're not feeling as good, maybe you're a little tired.
Seeing Alex and all the patients go through what they do, that trumps everything. They're so courageous and brave throughout this whole process. I mean, all our problems are minor compared to their problems.
So you went graduate school, or went to school rather, University of London, correct? And then you did your understudy there. And what brought you to Dana-Farber?
I came here to do my residency
Okay.
in the hospitals in this area, and then I stayed on after that.
See, that's the thing. We need to raise money to get smart doctors here.
Yes,
Still,
we
which
get
is
them back.
exactly what we have here in Dr. Wen.
Yeah, but before we go, Alex, we need to talk to you about something that I think all three of us may need to, I guess, enter. Because
Yes.
it's a competition.
This
Yes.
is his business now.
Yes.
Competitive people.
Yes.
Explain what you do, Alex.
So I work on a massively multiplayer online typing game called
Massively multiplayer.
It's called,
typeracer.com.
and you're the creator of it.
I am.
Right.
Yeah, I launched this game in 2008, and it kind of became an internet hit, and I've been.
So is it for people who want to become a better typist? I mean, how does that?
Yeah, I mean, it's for people, for the kind of people who like to compete. You know, like people who.
Is there like a junior level
Beginners.
for like
yeah.
for like
Beginner?
search and peck type guys like we
Yeah,
are?
one
One
finger.
finger guys.
Yeah.
Yeah, our algorithm actually like matches you up with people who are in the same.
So they can
league as
tell
you.
I suck at typing,
Well,
and
Christian-
then put me in a crappy pool.
So in other words, you'll be playing against a lot of 6-year-olds.
Yeah, no, I'm totally fine with that. They don't need to know how old I am, right? I just have like a screen name, just like any other game.
Yeah, exactly. So the first race, it puts you into the medium category, and then
Cat, C-A-T.
Yeah. See,
Where is that M?
hey, where's the question mark?
Dr. Wen, have you tried this game yet?
No, I'm a terrible typist.
She's curing cancer.
Exactly. Thank you very
I'm
much.
gonna go and compete one day.
Yeah, we should do it.
Typeracer.com.
We'll try it out.
We
Leave your
got it.
card.
All right.
We'll
Awesome.
try it.
Looking
Dr.
forward
Wen,
to it.
thank you very much for
Thank you
what
so
you
much.
do. We really appreciate it, and all the research and clinical studies that are going on, the advancement in brain tumors and eliminating them has been unbelievable. And Alex, you look like you're doing well. Congratulations. Continued
Thanks,
good
guys.
health.
And I just
Okay?
got word that the high score, 192 words per minute. Does
Yep,
that sound
yep.
about right?
Wow.
190. Is that
192 words a minute? Wow.
yeah.
what type of words are we talking here? Like big words or
So
like
5
Cat in the
characters per word is how we measure.
okay?
Yeah, not bad.